Hi, I'm Don Berwick. I'm a pediatrician and president emeritus and senior fellow at the Institute for Healthcare Improvement here in Cambridge, Massachusetts. I want to give my thanks to Laurent Degoe and the leaders of this amazing international conference on digital disruption. I was invited to join you in person. I wish I could be there. I'm very jealous and envious that you're there together, and I hope that I'll be able to be with you sometime in the future. But meanwhile, I'm thankful to Laurent and his colleagues for letting me join you in this way. Now, everybody knows that we've got an enormous opportunity to embrace the new possibilities that the digital revolution offers in healthcare, and that we haven't really done that yet. We have electronic health records and other advances in the use of digital technologies in our work, but isn't there a sense that there's some enormous possibility here to actually revolutionize care? Let me think about that with you. Let's recognize first, doing so would be highly disruptive. Our existing healthcare systems weren't built around this digital possibility. We have legacy structures and roles and buildings and habits, all of which will be threatened by and will be dislocated by the better use of digital possibilities in our work. This is going to dislocate and threaten some of our most deeply held assumptions about what healthcare is, what quality is, and what are the foundational structures and the core institutions that we need in order to become fully digital, to take advantage of this revolution. Now, look, this goes way, way beyond the electronic health record. The electronic health record is part of the digital future, but as the titles of your workshops at this conference imply, this is about a lot more than just digital formats for maintaining our records about the people we serve and what we do. If we're smart, we will embrace it. We will embrace this change. As disruptive as it is, we won't resist it. We're going to welcome it. Why? Well, because of our aims. The aim of all of us in the great world of healthcare is what we at the Institute for Healthcare Improvement call the triple aim. Invented by my colleagues Tom Nolan and John Whittington, they proposed that the social need for our work, where we're putting our efforts and our money and our lives in the pursuit of lower suffering, involve three aims at once. First, better care for individuals. People who are sick deserve care that's safe, evidence-based, reliable, patient-centered, timely, efficient, equitable. All of that matters when we're sick. That's the first part of the triple aim. The second part is better health for populations, because most of the illnesses that we live with certainly were not generated within healthcare, and in fact can't be dealt with in healthcare in the most effective way. They come from circumstances in our society, what we eat, how we move, the degree to which there is justice and safety in society, the degree to which our air is clean and our water is clean, the way we treat each other. And so the second part of the triple aim isn't just better care for individuals, it's better health for populations. And then the third part is lower per capita costs, not by rationing, not by withholding care, but through improvement. And that three-part aim, better care for individuals, better health for populations, and lower per capita cost, is a pretty good representation of where we need to head in all of healthcare. Now, the digital revolution can help in all of those. For better care, with modern use of information technologies, again, way beyond the electronic health record, think of what we can do. We can move care closer to people and their homes, freeing us from the trap, the fetters of large-scale institutions as the place to get your care. We can put care more under the control of people because they're in the digital world too, especially the new generation. And we can be more responsive to their individual characteristics. You know, with modern artificial intelligence, modern machine learning, we have a possibility we have never had before, and that is accurately matching what we do to every single person's needs with respect to their background, their genetics, their profile. We can actually have care customized to every single individual. And with machine learning, we can learn to do that even faster, even better in the long run than we possibly could with the unaided human mind. Care can break through to totally new levels of performance in this digital world. Better health? Well, with the expanded ability to reach into community resources, to link together efforts in communities, resources to work on social determinants of health, we finally, if we want, can get to a healthcare system that truly is focused on thriving, The digital world allows us to see and engage with people in the patterns of their whole lives, not just about their symptoms, not their diseases, and not just about the use of healthcare, but about life and holistic thinking itself. And lower cost, well, moving knowledge, not people, frees us from a lot of the cost of healthcare. Encounters, admissions, travel, all of that can decrease as we begin to use the movement of knowledge and the growth of skills in people as the fundamental approach to care. The hospital becomes, in that realm, a place of last resort. It's the place we go when everything else has failed, not the first place we go for care. We can maximize the skills and the capacities that patients and carers and communities can bring to bear on their own health in healthcare, just as we do now in other sectors of our lives in the digital revolution with mobile technologies and smarter use of information. We can improve transparency. That will allow us to achieve care that's far more responsive and, frankly, to give people better choices as they become more aware of what's possible in the world of health-seeking behaviors. We can integrate care across boundaries, creating virtual teams, understanding, so that people, as they journey through their lives, especially with chronic illness, can now experience as one united system of helping, not as separate silos of enterprise. All of this should reduce waste, wasted effort, dropped balls, errors in care, and repetitions and redundancy in care. Better, better health, lower cost, the triple aim. It becomes accessible by embracing the digital revolution. But nowadays people aren't just talking about the triple aim, they're talking about the quadruple aim, the fourth aim, and that has to do with the healthcare workforce. It will be impossible to get the care we need from a demoralized or stressed workforce, even at a time of decreasing resources. We need to increase the pride and the joy and the satisfaction of the people that give the care, the physicians, the nurses, the managers, the pharmacists, the therapists, the families, those of us who contribute to healthcare. Now, let's notice, initially, the digital revolution may be threatening, disruptive. What does it mean for me to be a doctor or a nurse, for example, when so much more control can be placed in the hands of patients and families and communities when they're doing the care as opposed to us? But that's transitional. In the bigger view, how much more satisfying it can become to be a clinician, a healer, when partnerships with patients are deep and more authentic, when more and more community resources are at our disposal, and frankly, when waste falls because we are able to focus our time, our efforts, our resources on what really matters to the people who we are trying to help. Now, we need diligence, of course. Diligence about privacy, diligence about sorting real value from things that don't add value in the digital world. We need diligence about preserving local autonomy and the rights of individuals and patients and communities to control their own destiny. But we can be smart enough to do that, to assure all of that, while we embrace this exciting future. So we can call it digital disruption if you want. That is one view. That is how it feels. But there's so much more possibility than that there. What about digital creativity? What about digital possibility? What about digital cooperation and more and more? We are on the threshold of new care, triple aim care, and the possibilities are boundless. You are the scouts. You are the explorers. You're the discoverers now in this conference and in what follows this conference. Enjoy the conference and enjoy this community of the future. And thank you for what you're doing.